ALLO-715 is a BCMA targeted CAR T cell therapy for treatment of multiple myeloma. It's being studied in a phase 1 study in relapsed refractory myeloma patients. So the unique aspects of this particular CAR T cell therapy are the following. It is actually an allogenic CAR T cell, means that it is produced from donor-derived T cells, third-party T cells, not from the patient. It is coming from donors, healthy donors, and these T cells, the CAR T cells, are actually manufactured and ready for the patient whenever they enroll on the study. Unlike autologous T cells, where the T cells have to be collected from the patient, then made into CAR T cells, there is no such step here. Here, the T cells are converted to CAR T and kept on the shelf, so that they can be used straight away without the collection step from the patient. It is unique in that this is the first allogenic donor-derived BCMA CAR T therapy in multiple myeloma. There are some special complications that could happen when you use donor-derived T cells. One complication is that the donor T cells can recognize the host tissue, the patient's tissues, as foreign and cause a immune reaction known as graft-versus-host disease, or GvHD. The other is that the host tissues, the host T cells of the patient can recognize the donor CAR T cells as foreign and reject them, and that would lead to loss of efficacy. Both of those problems were solved for this particular CAR T cell using pretty innovative engineering. So basically, the donor CAR T cells in this setting, in the ALLO-715 product, are incapable of recognizing the patient's own tissues as foreign because they undergo what is called a track editing or T cell receptor alpha removal by, again, gene modification. Similarly, the patient gets, as part of their conditioning regimen or lymphodepletion regimen prior to the donor CAR T, a product known as ALLO-647, which is a CD52 monoclonal antibody. This particular antibody depletes the host T cells dramatically. By the same time, the ALLO-715 product is depleted of CD52 surface expression, so the ALLO-647 does not affect the CAR Ts that are infused. So in this dual complications that can happen with donor T cells are eliminated, and that led to a successful phase 1 study, which is still ongoing.